Welcome back to Kariz Misha. Hair restoration has become one of the most discussed topics in modern beauty and wellness. With stress, genetics, and lifestyle factors contributing to hair loss, many people across the UK, USA, Australia, Germany, and France are exploring advanced solutions. Today, we'll break down two of the most popular treatments: platelet-rich plasma, PRP therapy, and hair transplant surgery, to understand which might be better for you. What is PRP therapy? PRP, or platelet-rich plasma therapy, uses your body's own blood. Doctors extract a small sample, spin it in a centrifuge to isolate platelets, and then inject that plasma back into the scalp. The platelets release growth factors that can stimulate hair follicles, strengthen existing hair, and improve density over time. PRP is non-surgical, relatively quick, and usually requires multiple sessions spaced over several months. Patients often report reduced hair shedding in thicker strands, though results vary. What is hair transplant surgery? Hair transplantation involves moving healthy hair follicles from one part of the scalp, usually the back or sides, to thinning or balding areas. There are two common techniques: FUT, follicular unit transplantation. A strip of scalp is removed and dissected into grafts. FUE, follicular unit extraction. Individual follicles are extracted directly and transplanted. Transplants provide permanent results since the relocated follicles are typically resistant to balding. However, the procedure is surgical, more invasive, and requires longer recovery compared to PRP. Comparing costs. In the UK, USA, and Europe, PRP therapy typically costs between $400 to $800 per session, with multiple treatments required. Hair transplant surgery, on the other hand, is a one-time investment, but ranges from $5,000 to $15,000 depending on graft numbers and clinic expertise. PRP may be more affordable in the short term, but it requires maintenance, while a hair transplant is a larger upfront cost with lasting results. Pros and cons. PRP pros: non-surgical, minimal downtime, uses your body's natural healing factors, improves thickness and scalp health. PRP cons: requires multiple sessions. Results vary by individual, not effective for advanced baldness. Hair transplant pros: permanent, natural-looking results, effective for larger bald areas, one-time procedure with lasting benefits. Hair transplant cons: surgical with recovery time, higher upfront cost, risk of scarring if not done properly. Hair loss isn't just physical. It affects confidence, social life, and even professional presence. Choosing the right treatment depends on how much hair you've lost, your budget, and your tolerance for medical procedures. Many people in Europe and North America view PRP as a booster, while transplants are the more definitive long-term solution. So which is better, PRP or hair transplant? The truth is, it depends on your stage of hair loss, your expectations, and your resources. PRP is excellent for early intervention in scalp health, while a transplant is unmatched for restoring hair in bald areas. If you're considering either option, always consult with a licensed specialist who understands your needs and can provide safe, realistic advice. Thank you for watching Kariz Misha. If you found this video helpful, hit subscribe and share your thoughts in the comments. Would you go for PRP, a transplant, or maybe even both?